Susan Angel is here to discuss the latest on migraine headaches and new research and medication out there to help people who may suffer from them, and they're not fun. Welcome, Susan.
Thanks for having me.
Migraines very common.
They are, and if you'll look at the statistics, there's millions of people in the United States that suffer from migraine headaches. Oftentimes women more than men, but oftentimes they can come in a chronic fashion where they're occurring frequently or either episodic. But either way, they can disrupt folks in terms of their work, their parenting, just the overall activities of daily living, so they can become problematic if not taken care of.
Yes, they can be debilitating. Oftentimes you hear people that have migraines have called in sick from work. They can't go to work. They have to go into a dark room and lie down. And sometimes there's even a vision portion where people see an aurora of some sort of flashing, shimmery lights with their vision as well, so they can be debilitating, really.
Absolutely, and there's so many different things that can trigger them. There is a genetic component, but there's also environmental factors that influence the onset of a migraine, which include various food, alcoholic beverages, caffeine, changes in the weather, stress, hormones. So there's lots of different factors that can impact the occurrence of a migraine and the frequency.
Okay.
So one of the things we're doing at CNS Healthcare is we are looking at a new medication to prevent these things.
So this is something that would keep them from occurring in the first place.
Correct. And what's really cool about this trial is that we've got, well, you might say, well, why do I need to do a clinical trial? What's different with this medication? Well, the thing that's really cool about this is it's unlike anything that's out on the market right now.
In what way? And what makes this different?
Well, right now we have lots of different pills, and they have various side effects. They can be helpful, but at the same time, then you have another set of symptoms that you have to deal with as it relates to the side effect. Okay. This treatment is a once monthly injection. It's a very small needle that you just get once a month that could help prevent the migraines.
Okay, so then unlike medication
where you have to take daily
in the pill form, or medication that you take at the early onset of when you're beginning the symptoms of a migraine, this is a shot that they would come in and get once a month?
That could help prevent the migraines.
Okay.
And I know some people may be, oh gosh, an injection. Well, I have to say it's nothing major, and I think the benefits definitely outweigh the risks. So if you're experiencing, migraines frequently that are disrupting your quality of life, this is something you should come speak to us about.
Okay, now tell me, do people have to get a hold of their doctor before they do this, or can we just call CNS Healthcare?
You can just give us a call. We have also an opportunity to schedule for an initial consultation on our website, but we can typically get you in on the same day, and during that first appointment, you'll meet with our nursing staff, and they'll do a detailed evaluation to look at your current physical status, your health history, current medications, and then review the clinical trial with you just to see if it's a good fit. And we always try to get their treating physicians involved, not in the sense that they're participating in the clinical trial, but that they're aware of your participation, and we oftentimes will seek out medical records confirming diagnosis and treatment so that we've got a real good continuity of care going.
And you also have the patient's history is what you're talking about, so you could be contacting their doctor with their permission.
Right.
And the neat thing about a clinical trial is oftentimes you don't have to, it's free of charge, especially if you have a hard time right now making ends meet in a tough economy. This is an opportunity to get medication absolutely free, correct?
It is, and not only that, I mean, you're getting the benefit of, a full medical team evaluating your care and evaluating you on a very routine basis. You also get a very thorough evaluation, which includes, lab work, a physical exam, an EKG. So we're really looking at the whole picture, and we want to make sure that that there aren't any underlying medical conditions that are contributing to your symptoms, and that you would be fully able to participate in the trial. And the thing that's great, back in private practice, we were always saying, okay, well, we need a payment, we need to process your insurance. And with this, we don't have to worry about that, because the patients come in, we don't have to worry about insurance or any type of co-payment. And in fact, the patients that participate with us receive a stipend for their participation. To compensate them for their time and travel for participating.
So what you're saying is that they can actually be compensated monetarily and get paid to participate oftentimes. And this is all made possible because when it's a clinical trial, explain to people what they may not know, but it's the drug company, the pharmaceutical company sometimes that is putting this medication out as a trial basis and conducting these studies before it actually goes widespread
For FDA approval.
For FDA approval. So all medication has to go through this process at some point. So this can oftentimes be a phenomenal way to take advantage of something that even your own doctor is not able to write a prescription for.
Yeah,
right.
and that's a great benefit, because so many people suffer with migraines, and like I said, it impacts them daily. And even with the medications, it can be very frustrating. So this is a great opportunity to see if this new medication would impact you positively.
Sounds great. And then if anybody's interested, call the number on the screen or go to the web.
Absolutely.
Okay, Susan, Angel, always a pleasure.
Thank you for having me.
And we'll have you back and talk about some more trials coming up soon.
Perfect.
Okay,
Thanks.
sounds good.